Thank you.
All right, thank you for the question. So at the moment, if we were to look into our cases, our concern is that the increased daily cases every day. And for example, if we have 3,000 cases, 10% or even 15% will be admitted to the hospital. There will be a category 3, 4, and 5. But majority, 85%, will be category 1 and 2, that is asymptomatic or they have mild symptoms. And we allocate the mild symptoms and also asymptomatic in PKRC. But obviously, we are not able to, accommodate all the positive cases at the moment. So we are looking into three solutions. Number one is, yes, we continue to maintain MyApes or even a PKRC, but that's mainly for those who identified certain groups that are actually suitable for the PKRC. We are also considering in terms of isolation at home, and this has been practiced in other countries. More importantly is that we need to identify the suitability of the home. If they have a space and suitable, then we will allow. And also we need to look into the age group, the risk group. If it's a high risk group, obviously we will not encourage them to stay at home. But majority young or not the high risk group, we can actually place them at home and make sure they use the MySejahtera and keep communicating with our state or district health department. So I think that's one way to solve it. Second is that to use a hostel, for example, in cluster Teratai, you use the male and the female hostel to accommodate the positive cases. So we have done that before. And third is looking into hotel to place a positive patient, category 1 and 2. We also have done that in Greece, Milan, whereby 2 hotels have been identified and positive cases been placed in the hotel and paid by the employer. So I think these are the 3 options that we have, and we will implement that. Now, looking into category 3, 4, and 5, if, for example, 3,000 cases, that means if you take 10%, we're looking at 300 or 450, 10 to 15% cases will be admitted to the hospital. And certainly, you have seen the figures, ICU beds, as well as the ventilated patient has increased double if you compare to last month. So we still have the capacity in our hospital, like Sungai Buloh. At the moment, we are running at ICU beds, 60 beds. But more importantly is that we need more staff to open up more space. So we have the capacity, but we are short of manpower. So we need to look into how we can increase our manpower. So in terms of positions, JPA is helping us to offer more posts to nurses and etc. So I think we are in process to recruit more manpower to our system. Then in the hospital, so we are looking into a COVID and non-COVID hospital. So there are 41 patients have been ventilated in non-COVID hospital because Sungai Buloh is already full capacity with the manpower that we have. But we do have capacity to expand from 60 ICU beds to 110 or 120 beds. But we need the manpower first. So other hospitals in Klang Valley, they are also taking in COVID patients. But the concern that we have is once you take in COVID patient, then the non-COVID patient will be neglected in that sense. So we fear that will happen. So now I think with the new MCO as well as the emergency order, we can actually work with the private hospital to look into COVID and non-COVID private hospital. So this is where we are. Tomorrow we have a meeting with the private hospitals, and then we will try to see how best we can accommodate. So we need to accommodate non-COVID, for example, for cases like cancer, semi-emergency, and etc. They can continue the treatment in the non-COVID hospital in a private hospital, private setting. And also, we also need to look into the capacity of the private hospital to cater for COVID patients. So I think discussion is ongoing. Hopefully, we can actually look into how we can accommodate in the increased number of patients, especially in Klang Valley. So in the 6 states that we identified, we will look into the capacity and working together, the public and the private comes together as one. Hopefully that we can manage. And by our action plan, so with the PKP or MCO, we hope that we can flatten the curve in next 4 or 5 weeks. the most important is to reduce the load of the patient. So within 2 weeks or 4 weeks, we can see the effect, and hopefully by doing so, we can have the numbers less than 500. So then it will take time for it to lower into flatten the curve further. So I think that is our plan at the moment. But more importantly is that everyone each have to come together together with Ministry of Health to break the chain of infection in this country.